Hi everyone, we're glad you can be with us today. My name is Jean. I am the Functional Medicine Health Coach for Redesign You.
And I'm Chad, the Certified Functional Medicine Provider with Redesign You.
And today, as promised, Chad is going to help us understand what functional medicine is.
So functional medicine is a little bit different approach towards medicine and towards the health of a person. It's more of a whole person focused, you could say systematic approach to somebody's ailments or somebody's symptoms that they might be experiencing. But just to give you a little history, I was doing conventional medicine for about 7-8 years, and during that time, everything was pretty much protocol based. I believe in conventional medicine, and please understand, I believe in conventional medicine. However, I think there's a lot of lacks in it. So I did a fellowship in integrative medicine for 2 years under Andrew Weil and Tyrone Lodog, which changed my life and our life actually.
And that was at the University of Arizona.
University of Arizona, and changed our life and especially changed the way that I practice medicine. Specializing in herbs and supplements, botanicals, mind-body therapy. And then it led me onto this track with functional medicine because I knew there was still some more. There was still more after what I had been through in my fellowship. And that set me on this 6-year journey with functional medicine, becoming certified. And the approach of it is the whole person. It is not just if this is your symptom, we're looking at the physiological pathways, the hormonal pathways, the energy pathways of the physiology of the actual body. It's not a guess. It's not a experiment. It is very real, science-based. I think that what sets us apart from most other functional medicine providers is that we're a team approach to this. We have a collaboration. My wife became certified in functional medicine health coaching because we knew that this was our life and we wanted to pass this on to other people because this is what we love to do. And partnering with an integrative cardiologist friend of mine and an integrative pediatrician friend of mine, it's been amazing for us.
So let me ask you a couple questions, or before I do that, can I make maybe a statement? So a lot of times in functional medicine, they show the picture of the tree and they explain that functional medicine is getting to the root cause of the problem, which may change the color of the tree, the development of the tree, the health of the tree, because you're trying to get to the root issue and not just treating symptoms. Is that true?
Yeah, that's correct. I hesitate in saying the root of the problem because it's used so much in medicine that people start to become desensitized to it. But it is the approach that we're looking for the underlying issue. As an example, a woman with a hormonal problem. Many times you go to conventional medicine or you go to certain types of other providers and they want to just give you hormones without investigating what's actually blocking that hormonal pathway. And that's why people will say in functional medicine, oh, it's for the rich, because people are always spending all this money on doing all these tests. And I can tell you, after being in this for a while now, you don't have to do that many tests. We don't need to do all these tests that people say we need to do in order to figure out the problem. And most of the time we can use insurance to do this testing pretty close to most of it.
Now, when you have a patient, will you use all three of your educations to help a patient?
Yeah, I'll use all three, and that's one of the things that I love about what I do now is the conventional medicine approach along with the integrative and the functional medicine. So the patient and I now will sit together in a partnership figuring out which approach do we want to actually take. Prime example, I just saw one just this last week who had been diagnosed with diabetes because of a high fasting blood sugar. They just had sleep apnea and they were being treated for diabetes. You treat the sleep apnea, the sugars go back down to normal. It's approaching the whole person rather than just a number or a lab. But yes, we use all three approaches and figure out which one the actual patient wants to go along with.
Now, I know people are probably wondering, but have you seen great success or are patients satisfied when they come to you for functional medicine and all that you work with them on?
Yeah, so it's an amazing question. The The ones that I see are not successful, which is few, um, and not the normal. But those few are wanting something to fix their problems. So they are wanting a pill or a vitamin or a supplement in order to fix their problem. And that's not what functional medicine is. Functional medicine is a partnership to come alongside of you, taking a proactive approach in your healthcare to be able to for you to be able to reach the goals that you desire to reach. So otherwise, no, I am seeing amazing success in people um, with very small interventions, not needing to do very much.
Now, I know that in my experience with functional medicine, there's usually a meal plan and probably supplements that are required in order to work with the patient. Is this something that's just normal for every patient, that they'll have a meal plan and supplements? And if so, how long do those last?
Yeah. So the meal plans, we do have certain types of meal plans that we like to use in functional medicine if somebody is showing specific characteristics towards certain types of symptoms, to give you kind of a direction. The problem with doing certain meal plans is it actually robs you of essential nutrients. And those essential nutrients your body doesn't make. You only get those through your food. So, such as in the SIBO plan, we remove a small intestinal bacterial overgrowth, removing certain types of essential nutrients that we need to give you in a supplement that your body needs to have to be able to be healthy. So, the least amount of supplements, the better. People come to my office with 15 different supplements from many people, and they do not need to take those amount of supplements. It's only alongside of the meal plans or the meal our goals that we're trying to reach for you, and it's only for a short amount of time, because food and exercise and sleep and figuring out the root, that's how you deal with this, not taking supplements forever.
Right, so food should be our medicine.
Food should be our medicine. This is what we love to do, and so we would love the opportunity to help you in whatever issues that you're dealing with, to be able to reach your goals without sacrificing your life or your lifestyle to do that.
Now, if someone wants to be your patient and they live in another state outside of Arizona, how does that work?
That's the big barrier for us right now, is you're not allowed to diagnose or prescribe across state lines. So for those patients that we do have that live out of state, it's more of a consultant. I am not allowed to diagnose or treat, but I can sure give a lot of direction on what needs to happen for them. I can make recommendations on supplements. I can make recommendations in lifestyle. I can make all those recommendations. I just can't do any prescriptions for that person.
Now, in Arizona, if you are interested in learning about functional medicine or being part of our functional medicine practice, you can go to redesignu.net, and our number is on there. There's an email on there as well, so you all can contact us. Now, there is, for people who are out of state, there is a website they could go to find a functional medicine individual.
Yeah, Institute of Functional Medicine. You go to their website and you can type in your zip code in your area, and it should give you a list of functional medicine providers around you.
Thank you for joining us. We are glad that you guys were here. If you're interested in learning more about functional medicine and if we're the right practice for you, please visit our website at redesignu.net. We're also on Instagram at functionalmedicine_life.
And do what my daughter always says to do, and hit the subscribe button and comments. Send us comments. That way we can help guide you in your questions.
That's right. So we'll be seeing you guys. Bye.